Warm welcome for joining in today's session. And we have a special session today with two powerful ladies that we have today. And they may have separate topics or area of discussion that they'll be talking about, but definitely this will give value and we'll put the initiative of Cogent Integrated Business Solution, who's behind this Zipinar for LetUsTalkIt, to create an informed and empowered community through free knowledge sharing through this webinar that we are doing, which is every Wednesday. That is 12 noon to 1 p.m. Eastern Standard Time. So if you have time today, you can watch us on YouTube as well and on Facebook on Let Us Talk It, and or you can join in our Zoom, and it is completely free. So without further ado, we have the first topic for today, which is the first leap. So you might be curious why it's titled The First Leap, but definitely stay tuned for further details why it's titled that part. But I'll give you a hint. The person who will be talking with this title is a wing commander in Indian Air Force. So it now makes sense why it's saying the first leap. So no one knows what each person is capable of, like the strength, till the time you step out of the comfort zone. So you never let the society thoughts, like what people would say, or pull you down. So you have to face it as per the speaker that we have today. So a brief information. So leading from the front, 14 years of proven military leadership and a wealth of experience in supply chain management, operations, strategic planning, project management, and vendor management. And a confident communicator and problem solver, skilled in multitasking, risk assessment, and decision-making under pressure. And also, having served as an Indian Air Force veteran, she has a deep understanding of the importance of supply chain. And also, she has a track record of reducing costs and increasing operational efficiencies through in-depth spend analysis, supplier assessments, and market analysis. In short, she is a handful of a woman. So without further ado, we have the person here, which is Priyanka Huda, who will be talking about the first leap. Please take over.
Hey, Phil. First of all, thanks for such a great introduction. So that has put a lot of responsibility on my shoulders to have a great talk with all of you today. So greetings, folks. Before I start with my talk today, I have a question for all of you. How many times have you dreamt of something and probably without any struggle, you have achieved it at a drop of a hat? I'm sure majority would say none. And those of you who are saying yes, probably you have the genie with you. Life is all about the struggle, and struggle is life. And the moment you start loving the struggle that you're undergoing, believe me, victory is at the very next step. Greetings of the day, folks. I am Priyanka Huda. I have 14 years of experience in the Indian Armed Forces. And during this time, I got this opportunity to represent India at World Military Parachuting Games. I have been the first woman of the skydiving team. I'm not here today to give you any motivational speech or probably start with some golden quotes and verses of people who have already embarked their journey on success. I'm here as a common person sharing my story, which has been consistent, had definitely struggles, ups and downs. By the end of this talk today, my endeavor will only be to seed in a thought in your mind that, believe me, guys, you are much, much more capable of than what you think you actually are. So I'll start with my life journey. I was the youngest of three sisters, and probably when I was born, instead of greetings from the relatives, they were empathizing with my parents. Instead of celebrating it, it was like, how would you manage, madam? They were consoling, they were feeling pity for my parents. And believe me, back in India, especially in certain parts of this India, having a girl child is not a very pleasant occasion in the house. And especially when it's 1+1 offer free, I was the third one. With this thought, with this environment, I grew for 17 years. And I'm sure the kids who are the younger ones can associate with me when you are constantly compared with the elder ones in terms of your sports activity, in terms of your education, in terms of the way you walk, the way you talk, the way you look. Comparison of, for everything under the sun that is possible, you are being compared for that. But nobody ever thinks what kind of impact is being put on the mind of the child. The child is innocent. The child doesn't know what it is. But constant comparison, constant compelling to do better is putting a very, very bad effect on his or her mind. And especially if you're a girl child, you are made to believe that you have to take what is given to you. You're given more than what you deserve. And probably they ask you to live a very ordinary life. This thing started making me having a sullen feeling. I didn't know how to explain it to somebody what I was undergoing. Especially during my puberty state, I stopped meeting relatives. I started avoiding people. I don't know what was happening to me, and probably I could not communicate to what was happening to me. The last nail in the coffin was when I could not score well in my exams. And my parents said to me, "You're the worst kid we could ever have. It would have been better had we got a male child." That was it. I locked myself in a room for days together. First of all, I stood in front of the mirror and I started thinking and I started feeling that the fault is within me. Maybe I'm not performing. Maybe, I am not up to the mark. Maybe I lack something. I need to improve somewhere. But then I realized, why should I feel victim of something in which I have no role to play? I didn't decide my gender. I didn't decide to come in this world. It was somebody's decision. That was the time I decided in my life, I will not let my life be in the hands of the society, in the hands of people who don't understand what a child undergoes. Why are you being constantly judged for something in which you have no role? Luckily, at that time, when it was the lowest time of my life, I got admission in Delhi University. For 3-4 months, it was a very normal activity. I used to go to college, I used to come back. One day, I was sitting in the lawns of my college, and there were a group of 14 people, rather, I would say 14 students. People were coming to them, people were talking to them. I felt, wow, what a life. People are giving them so much of importance. I think there's something great these people are doing. And they were the elected members of the college. I got a thought in my mind, this is where I want to be. Because I felt, I was certain that this is the only way I can break apart the skin which has been wrapped around me, which had an underconfident person inside me. But those who are studying or college students can associate that college elections, you have to have a corpus of money. I didn't have anything. I used to hardly get 600 to 1,000 rupees a month as my pocket money. I didn't want to bow down in front of my parents. And rather, what would I say to them? That why do I want that money? To stand the elections in the college? Why would I explain them? What would I explain them then for what I need this money? I mean, like they would say you have gone for studies. What will election do to you? I had no thoughts. I had no words to explain them that it is just not mere elections for me. It is about finding my lost identity, finding the confidence, finding the individual I've lost in me. I started doing a part-time job. I tried to build up a corpus. I could successfully do that. I still remember the sleepless nights I had, and I stood for the election. I lost by just 7 votes. But this time, this defeat was not something the way I used to feel in my childhood. I never locked inside. I didn't lock inside a room when I lost this time. Rather, I became more aggressive, more confident, and had a very focused approach that I have to win. This is what I want to, and this is where I can regain myself. I won the elections, and this was a huge margin of elections that I won this time. The moment I won the election, there were a lot of people around me. They were talking to me. They were saying, Priyanka, your campaigning was amazing. You're an amazing human being. You're an amazing communicator. The word amazing, Priyanka, I think I have not heard in 17 years of my life. I felt so great. I cannot maybe tell you what it made me feel that, yes, even I'm capable of doing something. People came to me, people started praising me, people said, Priyanka, you have been doing great. I started participating in different competitions, debate, declamations, the dramatics of the college. And everywhere I was going, I was winning because I had only one thought in my mind. I am more capable of what society think I am. I'm more capable than even what I think I am. I took the first leap outside my comfort zone. People just look at the destination where you are today. People look at that you are victorious. Who sees the journey that you have traveled? Who sees how much blood and sweat has gone in that pathways which lead to victory? And when you reach the victory, the happiness, the taste of victory, you forget all the pains that you underwent during that time. I had tasted victory and it helped me regain what I was. But this didn't end here. After 2 years, 3 years in college, I sat up for state services selection board. It's not an easy one. Probably a lot of successful people around in the world could not clear it. I made it in one go. The entire training of 1 year was quite rigorous. It demanded a lot of mental pressures. There were a lot of physical pressures. They definitely, grill us really hard because we are trained to be soldiers. I sailed through that training of 1 year. I would say with a lot of good achievements in the training period. And then I became an officer. Do you think I would have rested there? No. I am not meant to be ordinary. I had to do something extraordinary. I had to regain what I am. I have to bring to the society that please don't differentiate what a girl or boy is. That's not the individual's choice. So please don't penalize them for that. I joined the skydiving team. I still remember the day when it was my first jump. I had parachute on my back, half feet out of the helicopter and 1.5 inside the helicopter. It was a perfectly serviceable helicopter. All of you must be thinking, why do I need to do that to jump out of a serviceable aircraft? There was amazing wind that was blowing on my face. I was at a height of approximately 15,000 feet from where the world appeared very minuscule. The skyscrapers almost didn't exist to me. I closed my eyes and I thought, you can do it. If I have faced those times, why can't I do this? I did it that day. And after that, I did it again, and again, 246 times. Again, I did those jumps. And given an opportunity, I will do them again today. Due to this, I got this chance to represent India at the World Military Parachuting in Switzerland. Believe me, when I'm talking to you all, the scene is still alive in front of my scenes. It means a lot when you hold the tricolor amidst 32 countries. And I was leading the contingent there, the Indian contingent, hosting the Indian flag there. It was such a pride. It was a moment of pride, which I really can't say how it was. I still have goosebumps when I'm talking to you guys. This is the result of the first leap that you take out of your comfort zone. When I came back from the competition, India chose to represent and launch us on 2011 in front of India on the Air Force Day. My mother and sister had come to witness this program. And everywhere media was there. We were stealing the focus that day because it's little unconventional that women are doing such kind of activity. My mom, once I landed, she called me and said, I'm proud of you. Today, I don't feel any difference between a girl and a boy. She said this to me after 22 years. I was choked. I wanted to say, Mom, can you please repeat this? But I think that day, I achieved what I wanted to. I wanted to prove to her that there's no difference. There's only difference in your mind. There's only difference in the society's perspective. You don't have to be bothered with what society thinks. You have to stand with your child. You have to be the backbone of the child. You have to understand why a child is feeling low and performing bad instead of blaming the child for what is happening in his or her life. I really wish to wake up in this world someday where there's no differentiation on the basis of gender. Today, I'm in a transition phase where I am looking for opportunities in the outside world. There also, I'm ensuring that I will not compromise on anything. I am there going to give my best. I need the support of people who can help me reach out to different parts of the world and bring out such stories. I thank Talk It Now and feel that they gave me this opportunity to talk to you all. There are people, there are women, there are boys who have done much better than me. Probably we need to reach out to them and take their stories. We collectively need to make an effort to reach out to such people. They are the real brave hearts who are running this world and this show. I would like to rest my talk here with a message to all of you. Guys, you all are amazing individually. Just come out of your comfort zone. Just try to do something different. Never get bogged down with the thought what society will talk about you, what society will think about you. You are much, much more than what you think you are. Thank you, everyone. Have a great day.
Thank you so much for that very inspiring discussion that you have given. Would you like to show these photos?
Phil, a little flashback on the skydiving photographs that I had. Yeah, that's where we represented India in Switzerland back in 2010. And this is the day that I was talking when my mom complimented me, 2011. And this is what we do. It's all like back from the aircraft at 15,000 feet. We all are jumping out and we make a star formation. Yeah, that's us. That's us. I'm somewhere the smallest one, closest to the aircraft. Yeah. So the one at the bottom is me. That's a position which we make in the formations in the air. That's a US field where Arizona we were doing this training. And that's we after landing safely. The grin from beginning to end says that we all have landed safely.
That's everything.
Yeah, that's all. Thanks, Phil. Thanks, Swing.
Sure. All right, that's really wonderful. Thank you so much for sharing your experience to each and everyone. And for those who will be watching this on a later time. And yeah, for more attendees, anyone would like to interact or share your insights if you have questions to our speaker.
Yeah, Priyanka, that's an excellent, inspiring conversation. Thank you so much for the inspiration. We can hear in your voice and, wonderful inspiration delivered. Thank you.
Thank you so much. It's a pleasure.
So, yep, that's Srini, the CEO of Cogent Integrated Business Solutions, who's behind this webinars and doing the initiative of giving back to the community. Anyone else? Yep, from the attendees? Okay, so if none, then definitely we'll be moving to the next topic for today. It's a little early, but definitely this next topic would be more engaging, as our speaker would like to request if you can open your camera, and then if you have a little space in your area, because there will be movements involved in this next talk. And yeah, Priyanka, thank you so much again for that. Yeah, so anyone that's comfortable opening their camera and have a little space in their where they're sitting. Okay. So feel free to open your camera anytime if you wish to join in. Definitely, I will be joining in with Dr. Praharsha. And yeah, Doctor,
Hi.
are you?
Hi, am I audible, Phil?
Yes, let me give you a little introduction first. And then, yeah, so to give time to our attendees to open their camera if they wanted to.
Sure.
And yeah, so the text, like the next topic we'll be discussing is about know your posture. So it's simply saying know your posture. Like everyone else is, it's something that we do not mind in our daily movements or things that we do, our errands, each and every step that we make. Like we don't really see how our posture is. Like we do not see ourselves every day. So knowing the basics of posture, how our body parts are interconnected as units, what happens when the alignment of these units is not properly done. So we have here Dr. Praharsha, who is a very passionate musculoskeletal physiotherapist trained in obstetric physiotherapy too, and she is a founder of Guest Physio Clinic. She has experience of more than a decade, and she has been a team member of National Resource Center for Electronic Health Records Management, India, or NRCES. So without further ado, we have Dr. Prarsha to give us a discussion and also give us the movements that will help us to know our posture. Please go ahead, Doctor.
Hi, Phil. Thank you so much for such a great introduction. And I would like to first thank you, Priyanka, for such a motivating talk. And yes, we all are made not to be ordinary, but to excel in each and every thing we do. And yes, Priyanka, everyone is proud of you. I think we don't have Priyanka here now, but yes, we are all proud of her.
Yeah, thank you so much for that.
So yeah, so now I'll start the screen sharing.
Yes, go ahead, please.
Can you see my screen now?
Yes.
Okay. Okay, so can you now see the next slide?
Yes.
Okay, yeah. So hi everyone. If you all can, see my slides now. My first slide has four males sitting in different postures. So I would request you all to kindly switch on your cameras if that is comfortable for you. And if not, then also try to sit straight with your back stretched out as tall as possible and your shoulders tucked back, okay, and your chin tucked in. Take a deep breath and relax, okay. So let us first start with what is exactly posture. Posture is actually the alignment of body segments, different body segments. Okay, so we'll start with the agenda first. So we'll first understand the definition of posture, and then we'll come to the comparison of the normal and the abnormal posture. Then we'll understand the basis of posture, that is kinematic chains, mechanical concept given by an engineer, and what are the benefits of having a good posture, different factors which affect the posture, and why am I explaining you all these things, why a physiotherapist is important, and what are you taking away from this discussion today. So starting from the definition, posture is alignment of our different body parts, okay, in respect to the other segments. Okay, so on right side you can see three images, three movements which tells you the different body alignments. Okay, so in this era of technology, when we have everything which is starting from technology only. My presentation also is part of that technology only today. So we have more of sitting posture. We do everything in sitting alignment only. So we should try to work out on our sitting posture and correct it. Okay, so the next thing is on right side, there is a beautiful lady who is showing us the good posture and then the abnormal posture. The good posture is having the earlobes and the shoulders all aligned in the same plane. Okay, so your earlobes and your shoulder comes in the same plane. When they come in the same plane, then that is an ideal posture. And when your earlobes go forward like this, am I visible?
Yes, yes.
Okay, so when your earlobes go forward, then your shoulder, then that is called as forward head posture, and that is an abnormality. Okay, this is an abnormality. Okay, so when the head goes forward in relation to the shoulder, then after some time, maybe 2 or 3 months, the alignment of the shoulder also changes. Okay, the shoulder starts to droop in towards your chest. It will be like this. Okay, so that is the rotation of the shoulders. Okay, and after a certain duration, the rib cage will also be affected due to this posture. Okay, and coming to the abdominal area, when your abdomen is protruding out, this area, this C curve will be increased. Okay, so this is abnormal posture and this is the normal alignment. Okay, so I'll explain the left picture again in the later on discussion. This is again the forwarded posture only. You can clearly make out that the line is clearly depicting that the planes are different for the earlobe and for the tip of the shoulder. Okay, and on the right side, the line is almost in the same plane. The both things, the earlobes and the shoulder, are in the same plane. Okay, so what is exactly the basis of posture? So posture actually works on many segments. There are many segments in our body which are interlinked, and yes, our toes are connected to our head. Okay, so we can't say that if I am having an injury in my ankle, my rib cage won't be affected. If that persists for longer duration, maybe for 5 years or 6 years, then after that, maybe my rib cage will also be affected. Okay, so the joints are connected through the chains, and the muscles are connected through the fascia. So each and every part of the body is connected to the other body part. Okay, so that is why we should take care of our posture when it is in the acute stage, when it is having a minor issue, or otherwise it will spread out to the other linked segments also. So what are the negative effects of having a poor posture? Okay, so starting from our brain, we will have decreased cognition. The stress will be more. See, there can be vice versa also, vice versa effect also. The stress can lead to bad posture, and the bad posture can also give you stress and anxiety. Okay, and as I told you that when the forwarded posture is there, then the drooped shoulders will be there, and then the decreased lung capacity will be there. The lung expansion will be reduced. Okay, of course, my appearance will be totally bad. So then my confidence will also be decreased. Okay, because my muscles are not aligned properly, so there will not be proper flow of the blood, and hence the oxygen supply will also be hampered. Okay, there will be muscle tightness, and muscle tightness can also give you headaches. Okay, there are headaches which are caused by the muscle tightness in your neck area. If this area tightness, muscle tightness, gives you headaches also, and yes, your digestion is also affected because of your posture. Okay, so can I ask you that how many of you have pains apart from me? I am also having headache today, good headache today because of good workload. So can anyone share or anyone raise hands who is having pain today?
I got on the lower back,
Okay. Okay.
pelvic
So,
area.
okay. Anyone else? Anyone
Yeah,
else will
occasionally, yes, occasionally, sometimes, when we sit for a long time, I think that is there. Yeah.
uh, you are having pain in which area, sir?
Same, lower back.
Back, lower back. Okay. Okay. So my professional ergonomics and your ergonomics will be different. But you, in your case also, all of your employees or all of your team members won't be having same type of pain. Okay, so everyone will be having different pain. So what makes these pain different? Why are you having different body pains even when you are working almost in the same environment? Broadly, your work profile is the same, right? You are working with a computer or with a system. Of course, the technical aspects are different, but yes, the broad aspects are same. So what makes the pains different? Let us understand these factors because the posture is really important, because the better posture can give you good productivity and can increase your work profile and work structure. So coming to the factors which affects our posture. First is our bread and butter, the profession, and the second is trauma or injury. The third is the most ignored one, the footwear, and stress and anxiety, a sedentary lifestyle, and physical attributes. So we'll try to understand each and every factor which affects our alignment, our body alignment. So we'll start with dentists. So dentists have their alignment as when they are giving services or dealing with their patients, they deal with their patients like this. Okay, so they have to access the teeth and they have to put inserts or put the wirings on their teeth. So their position is like this. So again, they will have forward head posture. Okay, and they will forward head posture. Now you can make out, right? This is forward head posture. And because they are bending like this, they will be having rounded shoulders also. And rounded shoulders will be accompanied by this droop posture. This is called as kyphotic posture. Okay. Please tell me, Phil, if I am not visible or you're not able to understand something.
Yes, you're visible, definitely.
Okay. So
Okay.
the other is the others are like scoliosis can also happen. Scoliosis is a deformity, a postural deformity which happens in the different plane. Like your spine is aligned in this plane, right? So when it changes the alignment in this plane, not in this plane, in this plane. So the sagittal plane aspects, that is called as scoliosis. Sports person have kyphotic body posture and shoulder injuries. Kyphotic body posture, now you can understand, and shoulder injuries, because throwing athletes will have shoulder injuries, and again scapular asymmetry. So what is scapula? So we have two triangular bones here on the backside of our thorax, one left side and one on the right side. Okay, so if you can imagine that this is your thorax and this is your scapula. So in the athletes, the scapula is usually aligned like this. Okay, so there is winging of scapula. It is not completely on the thorax. Okay, it is lifted up from the thorax, from the internal border. Okay, it is lifted up like this. Okay, so that is called as winging of scapula. And if it is not properly taken care of, then it will lead to the postural abnormalities in the later on stages. And then rounded shoulder position. Rounded shoulder position is this only. Okay. So next, coming to surgeons, the spine surgeons or the orthopedic surgeons, they will have again the forward head posture, the rounded shoulder postures, the hyperkyphosis, and the scoliosis. Beauticians, yes, beauticians also have postural abnormalities. Okay, so the next time when you visit your beautician, kindly inform them or educate them that yeah, they suffer a lot of pain because of their position. So when they do this movement, forward and back movement of their neck, then they have forward head posture and they have headaches due to that. Okay. Scapular asymmetry is also there because of their continuous alignment on our face and on our body parts. Okay, hyperkyphosis and scoliosis that comes in the later pictures. And then genitors, due to lots of physical activity, they have kyphosis, forward postures, and rounded shoulders. Then coming to the most important thing, the IT professionals, because of the long sitting posture, the IT professionals should work on each and every aspect, starting from the toes to the head. The alignment of the toes also matters while you are sitting on your chair because you sit for longer durations. Okay, so uh, abnormal postures includes forward head posture, rounded shoulder posture, hyperkyphosis, anterior pelvic tilt. Anterior pelvic tilt is pelvis is this part of your body, the bone which connects my hips to my thorax. Okay, so this part, this pelvis is tilted towards the front part. That is called as anterior pelvic tilt. Okay, and tendoachilles tightness. Tendoachilles tightness is the tendon which is present on the ankle, on the back side of the ankle. Okay, so that becomes tight when you are not sitting properly on, when your foot is not resting properly on the floor. Okay, and physiotherapists, yes, we too have abnormal postures, and that includes forward posture, scapular abnormalities, and increase in the lumbar lordosis and knee hyperextension. What is knee hyperextension? When we stand, our knees should be slightly bent. We should have at least 5 to 7 degrees of bend in our knees. Our knees should not be completely straight. So when our knees goes into hyperextension, that is abnormally over straightening of our knees, then it leads to hyperextension. And that in later on stages causes issues in your lower back. Okay. So this was the most important thing, your profession affecting your posture. So this picture clearly explains the issues with the surgeons when they deal with their patients. Okay, so this is the kyphosis. The blue dotted line indicates the kyphotic posture of the surgeon here. The next aspect is the effect of trauma. So I have now we understand that our profession is affecting our posture. So now I'm maintaining my posture in my workplace. I'm trying to take good measures to take care of my posture. But when I come out of my office or my workplace, then I had an injury, maybe a simple ankle sprain, and that ankle sprain gave me a tough time. I could not do proper exercises, or I could not take care of it because of time constraints, and it continued. I went on to my workplace and came back. Normal activities were continued. So in longer run, there will be tightness of certain muscles, and there will be lengthening, abnormal lengthening of the other muscles. Okay, so when we say the tightness, then let us understand with this concept that this is my elbow. I hope you can see it. So
Yes.
these muscles, when I bend my elbow, these muscles are the on this aspect or this area. This is called as anterior area. Technically, this is the doer muscles, the agonist muscles, and these are the resistor muscles, the muscles which are controlling this movement. Otherwise, if these muscles, the back muscles, are not working properly, then my hand will be thrown like this. There will be no control in the movement. Because these muscles are resisting the anterior, the forward muscles, so this movement is so gradual and so controlled. Okay, I'm not throwing my hand like this. I am trying to do it very slowly. Okay, so these two sets should work in synchrony with each other. Okay, so when my elbow or my ankle, any joint is affected, one set of muscles become tight and the other set of muscles become loose. So we should try to take care of these two mechanisms, and we should try to balance that posture at that particular joint only, so that it does not involve the other joints. Okay. So whenever, because now we know the kinematic chain, so we understand that when a particular joint is involved, then one joint above and the other joint below that particular injured joint is also involved. Maybe in the later on stages it will be involved, but you can't escape that involvement. Okay. So trauma also affects our posture, so we should consider it. And then the next thing is effect of footwear. Again, the most ignored thing. When we go to get our footwear, we should try to have these points in our understanding. These considerations, the considerations which I'm explaining you now, should not be there in your shoes, in your footwear. Okay. So the heels should not be above your toes. Okay. So there should not be elevation of the heel above your toes. Okay. And your toes, as the picture clearly tells you, that the toes should be very free. The toe box should be very free. The toe box should not be tapered. Okay, there is a fashion now that it is the shoes are in trend that they should be pencil, or they should be very narrow in the front portion. So, but that is not at all healthy for your toes. It may cause fractures also. Okay, hairline fractures will be caused, but that will be also bothering you, right? So after your toe balls, I'm imagining this as my foot. So after your toe balls, your toes should be completely free in the toe box of your shoe. Okay. And the heel should not be above your toes. Okay. And you can always note down the slides, or note down the number of that particular slide, and ask me questions when I'm done with my presentation. Please feel free to note down the points, and I'll be more than happy to explain your queries. Okay, so when these criterias are there in your shoes, when your toe box is very tight, when your toes are very tight and attached to each other, to the other toes, then the alignment changes at your knee in longer run. Okay, so the knee goes into hyperextension. As I explained you, there is over straightening of the knee joint. Okay, so that will lead to, or that may lead, according to your physical activity, that may lead to osteoarthritis in early stages only. Okay, so the next factor which affects our posture is sedentary lifestyle. So when we are in this area of knowledge and technology, we are spending most of our times sitting on a chair, from our loo to our bedroom. Everywhere we are sitting only. Our couches, our sofas in our areas, like in our TV rooms, and our dining tables also have chairs only. Now we don't sit on the floor. So we have sedentary lifestyle. We have less of physical activities now, and we have more time in our work area now. So, and we are not able to manage the ergonomics of our workplace and our residences also. So this leads to forward head postures most of the time, and headaches, and the brain is anxious now, the mind is not at all restful. Okay, so that is giving you lots of trouble. Okay, so yes, sedentary lifestyle affects you many times and gives you a tough time. Okay, so the next factor is stress and anxiety. So as I explained in the first slide only, that stress and anxiety may give you a bad posture, and a bad posture can give you stress and anxiety also. So whenever we are having, our shoulders go into this position. Okay, so you can observe this when you are driving and there is too much of traffic and you are trying to control the two-wheeler. And I'm trying to explain the position of a two-wheeler. So you are trying to hold the handle too tight because the movement is less. So that time your shoulders are shrugged like this. Okay, so and this causes lots of stress on your head and gives you headaches. Okay, so whenever you are driving or whenever you think that today you have lots of driving in your activities or anything which makes you tensed, then try to do breathing and try to relax these muscles. These muscles are really important for our breathing and hence they cause headaches also. Okay, so coming to the next topic, why am I here explaining you all these things about the posture? Why a physiotherapist is important? So professionally, physiotherapists are trained with biomechanics. We are the people who will explain you the length and the strength of each and every muscle of the joint which is affected. And of course, as I explained you, the joint above it and the joint below it. So when you come to us telling us that you have shoulder pain or you have headaches, then we'll not only access your complete neck also and your shoulder also. So, and the beauty of our profession is that you don't need to take any pills, any medicine, and you can get rid of your pain just by doing exercises very sincerely. Okay, so yes, posture is the area or a facet of a physiotherapist. A physiotherapist can very beautifully manage this issue. So some of you will be thinking now that yes, all these things are there, but how? Why should we bothered about these things? These are very common things, and everyone has this. So I can ignore this. I can ignore these issues now. But if we ignore these issues and we unfortunately don't have any physical activity or very less of physical activity at that particular joint, say I have lots of typing work at my workplace. Daily I type more than 200 or maybe more than 100 pages. Then I have more of this movement only and I am not giving proper movement at my wrist. So my wrist will be having lot of issues and that may lead to carpal tunnel syndrome in the later on stages. Okay, and if I have a more sitting job and I'm not doing the opposite motion, then I will have headache which are caused due to the tight muscles of my neck area. Okay, so that is called as cervicogenic headache. Cervicogenic headache is a headache which is unilateral, that is on the only one side of your head. Okay, and when you have these issues, these postural issues, the very abnormal alignment of your cervical spine and your lumbar spine. Lumbar spine is lower back and cervical spine is your neck area. Then there will be degeneration of your vertebrae of your smaller bones of the spine, and it will lead to inflammation, leading to spondylitis. You all must have heard about this term, spondylitis, right? So, and the knees, if there is over straightening of the knee, as I already told you, the poor foot wear can lead to the knee osteoarthritis because there will be over straightening of the knee joint. Prolapsed disc will be there due to the degeneration. And then again, upper cross syndrome and the lower cross syndrome are caused by forward head posture. Forward head posture will be giving you tightness of these muscles and tightness of these muscles and overly lengthening of these muscles. Okay, and lower cross syndrome will be giving you this position, this position. This will give you tightness of these muscles and overly lengthening of the back muscles. So now we understood that what is the problem. So what should be the solution? Yeah, can anyone try to come out with like what should we do? Anyone? Any easy solution? Anything, any random thought.
No, no thoughts coming in.
Okay, so just an observation that what is there which is changing my, which is changed in my body. Okay, so when I'm feeling uncomfortable, uh, when I'm feeling that I'm not comfortable in my body these days, I am having pains in my body, then I can try to observe that what is changing. Maybe my posture is changing, maybe my shoulder are drooping now, maybe my head is coming forward, maybe my pelvis is drooping forward. Okay, so I can observe these things. If I can try to do these things like periodically, maybe once in a week, twice in a week, try to understand that what is causing the pain. If I am a good observer, I can make out what is causing that pain, what is changing, what are the new things that are happening in my body. Then I should do the opposite movement. See, if I am observing that my pelvis is going forward like this, then
Mhm.
I should do the opposite movement. Okay. If my head is going like this, then what should I do? I should place two fingers on my chin and just take the head back. Okay, and try to hold it there. So I should do the opposite movement if I am a good observer and I'm able to make out. Okay, so first point is observation. Observation is very easy thing to do. And next is give yourself 2 minutes of time periodically to make a confirmed statement that yes, my observation is right. And third is to do the opposite movement, opposite of that abnormal movement. And if you are not able to do opposite movement, or if you're not sure that this is the abnormality, then you can visit a physiotherapist or your family physiotherapist, and he or she will be more than happy to help you. Okay, so like I would, I'm not sure that I have less time here, but I'm not sure. I just had this agenda in my mind that I should be able to explain you that your toes and your head, your shoulders and your rib cage are all interconnected, and one abnormality can involve the other joints also. Okay, so take care of the smaller abnormalities so that they don't spread out and they don't involve the other joints also. Okay, so
Yeah.
that was my agenda for today, and I would like to welcome any ideas or anything, any other topic about which you want to hear from me the next time. And you can get the references, the other references also from me. And if you want those references, those articles also, I can mail you. Okay, I'll be more than happy to do that. And yes, so I'm now done with the theory part, and I welcome any doubt or any query from the participants.
Yes. Does your choice of footwear affects like how fast you get cramps?
Cramps in your foot, yes, the proper positioning, the abnormal positioning will have cramps in your foot, but cramps are associated with many things, like proper electrolyte. You should drink more of water. Okay. Yeah, water intake should be increased, and you should do stretching of the TA joint. Okay, so your ankles should be properly moved. Your feet should be taken back and then down. This movement should be done very slowly and with held for 30 seconds or so, and repeat this movement for 30 times. So, and do this on your bed when you are about to get up in the morning. Okay, so when you do this overnight, our tendo Achilles joint is tight because 8 hours we are in the same position, and again the 8 hours, the next 8 hours we are keeping our feet in the same position in the office or in the workplace, right? So that gives tough time for the feet. So we should try to move the feet when we get down off our bed.
Perfect. Yeah, I get. I guess it's just right. About time. Well, definitely. It's really a wonderful talk. It's very helpful and very enriching. Because like we just do our job, right? Like it's like we don't always mind how we sit, how we stand in some cases, especially when you
Yeah.
mentioned like stress. Whenever ever and like each one is like stressed or in distress, like they cannot really see how they posturize, like how they
Yes.
move. So that's really enlightening. And anything you'd like to promote before we end?
Yeah, I would say that you should do the movements every 45 minutes or every hour. You should try to take a walk. Yeah, because a walk is good for your body. Movements give you good mobility and decrease the chances of tightness of any particular joint. Okay, and try to stretch your muscles. You can just do normal stretches like normal head movements, the forward normal movement and the backward movement. These normal stretches will do good for you, just the basics. And if you want, if you observe that you have some abnormality or something is bothering you while you're working, then of course you should have a personal one-to-one assessment done for your body for that particular joint.
And Eva, thank you. And if anyone would like to interact with you offline, or if they wanted to ask if you have virtual services as well, like, yeah, how can they get in touch with you, or how will they reach you?
Yeah, so here I have mentioned my phone number and my email ID is also there. So they can get in touch with me on my phone number and on my mail also. So I'll be more than happy to reply them. And I would request everyone to give me the feedback form also, fill it, and so that I can get in touch with you if you have any queries or if you need any consultation, then I can help you out. Yes.
That's perfect. So, for those who have the availability to screenshot this what's on the screen right now, please do so. Or for those who will be watching this video on the later watch, please feel free to consult if you wish, or if you have abnormalities on your posture or anything that you're experiencing pain. Maybe it doesn't need medicine, it just need the right person and the right exercise to do so.
Yes.
All
Yes,
right.
absolutely. Yes.
So that's a wrap up. Thank you so much, Dr. Praharsha, for the wonderful
Yeah.
talk. And I'll
Thank
give
you,
you
Phil, for
more time.
having me.
Definitely, your knowledge, skill, and experience you have shared to the community is really worth it. Thank you so much again for that. And for Priyanka, who have to rush out something necessary, thank you so much as well for giving us your time and your experience today. And for those who will have watched this and will be watching this, please feel free to like it happens every Wednesday. We have webinars. We have two new speakers and two wonderful topics that we have. It happens every 12 noon to 1 p.m. Eastern Standard Time. So you're very welcome to join in, and please feel free to do so. Or you can follow us on Let Us Talk It on YouTube, so you can watch our previous videos as well and watch out for our upcoming videos. Alrighty. So thank you so much, each and everyone, and see you again next Wednesday. Take care, everyone, and all the best.